Hello, everyone. We are live. Hello, my name is Stacy Nell. I'm the Executive Director of the Kansas African American Affairs Commission, and we are back with our regularly scheduled Monday Lunch and Learn. Today, I am thrilled. I'm always thrilled, but I'm thrilled to always be joined by Geovannie Gone. She is the Executive Director of Immunize Kansas Coalition. Hello.
Hey, Stacy. Good afternoon. And it's actually Geovannie Gone. I forgot that little apostrophe on the E.
You know, as a person whose last name is continually mispronounced. There we go. Gone. All right, fantastic. Geovannie Gone. Well, thanks. I wanted to just briefly give a background about you and your organization. So, originally from Mexico and a longtime resident of Garden City, Kansas, which is where you are now. Geovannie previously served as the Chief Administrative Officer for Genesis Family Health. As the Chief Administrative Officer, she oversaw the development and implementation of organization and business strategies, community outreach teams, and new business initiatives. Gone prides herself in serving her community and currently serves as a member of the State of Kansas Nursing Board and advisor for the Kansas Hispanic Latino American Affairs Commission, my counterpart down the hall there. She provides oversight for the government grant programs and other enabling services of the corporation. She thrives in finding ways to innovate and strategize plans to increase vaccine rates and to reduce vaccine preventable diseases. With over 15 years of healthcare experience, Gone is a graduate of Fort Hays Graduate School and has a master's degree in public health. She's also a licensed nutritionist and a licensed addictions counselor. All right, so thanks. Welcome today.
Yes, thank you, Stacy, for having me today here in your show.
Good. Now, the first question I always ask everybody is, what are you having for lunch?
So I absolutely love chicken. So I usually have like chicken breast and rice and usually a veggie, either broccoli or peas. Today I had peas.
That sounds way healthier than what, I mean, I had leftover. We had like a chicken Caesar salad last night as well. So I had leftovers, but driving in, I was looking at McDonald's, like I really just want to go to McDonald's, but good, healthy.
Yes, try to. It definitely boosts the energy.
Definitely. Well, I wanted to talk about, I brought you on specifically because of your work with Immunize Kansas. And immunizations are definitely a hot topic these days, right? There, within the last, I think, from my own life experience growing up, it was like, oh yeah, you got to get shots. You know, you get shots, and that's just what you got to do. Within the last, easily 4 or 5 years, it has taken on a definite turn. So, what at your work at your coalition? Can you give us some facts about immunizations? I think that's a good place to start. What are some of the facts out there that you wish people knew about immunizations in general or ones in specific?
Yes, thank you, Stacy, for making a note of that. I do believe that the COVID-19 pandemic really changed how the public views vaccines. And so before the pandemic, we did saw a lot of questioning and misinformation going on in regards to the vaccines and its effectiveness on preventing some of the diseases. During the pandemic, I think that because of the COVID-19 and the new mRNA scientific methodology that was utilized to create the vaccine, we saw a little bit of shift as to individuals questioning vaccines, and now they question all vaccines, which is pretty alarming when you think about, truly preventing those diseases that have been eradicated because of vaccines. And so we know that there was a lot of questions in regards to the COVID-19, especially with the new technology and the COVID-19 vaccine being developed so quickly.
Right.
I think it also had to do a little bit of, what the country was kind of living at that time politically, and also in terms of, rights. I think that was a time that a lot of individuals were questioning government and politics. And so the pandemic just kind of made those differences even bigger.
Right. Yeah.
there was and there still exists a lot of disparities among the minority groups. We saw that 1 in every 4 African American died because of COVID. We saw that a lot of the misinformation that went on within the Hispanic and the other minority groups, had to do with misinformation being shared via social media or even via, some of the people just kind of talking to friends or families and their experiences. So it really has affected how society sees vaccines in general.
So we talked, because we were chit-chatting a little bit before we went live, because even I know for myself with the COVID vaccine, thinking, wow, that was quick. And I mean, I understood intellectually, even, and I'll let you talk about the mRNA, but even the idea that this was a global pandemic, I understood that a lot of scientists were maybe cooperating in a manner that normally they don't cooperate. Like usually it's competition. Like if you work for one, you're going to compete and not share information. And I think with the COVID vaccine, people had a understanding that we need to work together and all of us get to a goal. But talk about the mRNA.
Yes, so mRNA stands for messenger ribonucleic acid. And so scientists have been studying coronaviruses for more than 50 years. So scientists were already kind of in this process of truly seeing the data and the structure and the genes and the life cycle of this type of virus. So coronavirus comes from a family of viruses. We saw this in 2002 with the SARS coronavirus, and then the MERS coronavirus in 2012, which it is a virus that usually affects, like it's usually around common colds and like acute respiratory syndromes. And so all of that came kind of before. So scientists were kind of aware of this, this virus. And so they had been working on what it's called spike protein, which is what allows the virus to enter into the cell and infect us. So when they went ahead and created the mRNA shot, is kind of a virus that helps our immune system identify this spike protein and protects us and kind of fortifies our immune system and kind of reacts. A lot of people mentioned that whenever they had their COVID-19 shot administered, they got sick. Well, it wasn't because, the shot, had any of the virus. It was because it was an immune system reaction, their immune system, identifying this vaccine and getting ready to prevent the coronavirus in case of any infection. And so we saw a lot of individuals have no symptoms at all. I, had my first and second dose and had no temperature. My arm, a lot of people complained that their arm hurt or that they felt a little bit sick, the next day. I did not have any symptoms. My 2 kids, my 2 teenagers were vaccinated when the Pfizer 12 to 18 got approved, and they did not have any symptoms. And then when the vaccine for younger kids, the 5 to 12 got approved, my son, who's now 7, got the vaccine and he did not get sick. But my mother, who is a, I'm not going to say her age, Stacey, because she might get upset with me, but she did get the vaccine and she was sick for a couple of days with soreness. Right. And a little bit of dizziness. Everybody reacts a little bit different to the vaccine, but all in all, it does protect at least, it's 98% effective.
It's interesting that you bring up like the different reactions. In a way, I've always felt that part of the problem with COVID-19 as the virus, and then with the vaccine is that everyone doesn't have the same response, right? And that somehow that lends itself to the misinformation. Because I remember when Ebola was happening, Ebola had a kill rate of something like 98%, right? Like if you got Ebola, you were gonna die. And so it was, everyone was like, oh, this is bad. You know, like quarantine means something, and, you know, this is something that needs to be taken very seriously. And that's the thing that always I thought was, well, I suppose it's good and bad. Like I'm good that coronavirus didn't have a 98% kill rate like Ebola, but the fact that some people can even get coronavirus and just be like, oh yeah, it was like a cold, and yet other people are dying. And so same thing with the vaccine. Some people can get the vaccine and have no reaction. Some people get the vaccine and have a reaction. And that sort of fed into the misinformation about the virus and fed into the misinformation about the effectiveness of the vaccine, unfortunately.
Yes, Stacey. And something else that we want to note is that, you know, even though a person might be vaccinated, that doesn't mean that they can't get sick.
Yes.
So they can't get sick. You know, the vaccine, what the vaccine does is that it prevents the COVID-19 to moving into a phase where they might need hospitalization or an intervention. And so it kind of guards them so that this can be something that they can take care at home instead of having to be hospitalized.
That's an important distinction. Thank you. Thank you for getting that out. Okay, so now in your work, I know we've talked a lot about COVID vaccine, but your work is not specifically or singularly focused on COVID. So what are some of the other areas that we talked about preventable diseases? So what are some of those other ones?
Yes, so we currently have 26. And if you think about it, that is a ton. So we currently have 26 vaccines that prevent infectious diseases. And many of those have been eradicated, like polio and measles and mumps and rubella. And so we have, unfortunately, because of, you know, this wave of individuals now questioning vaccines, have seen a spike on measles outbreak. And so just recently, we were following a measles outbreak that happened in Ohio. And, you know, as we looked into the data of, you know, what happened with this outbreak, how can we prevent it, you know, being here in the state of Kansas, we noticed that about 80 to 85% of those kids were unvaccinated. And so again, as we think about our state, as we think of individuals, I think our state is a very, a lot of people move in and out of our state. We have a large population that are migrant and refugees and asylees. And so as you think of that population moving into our communities, we've realized that many of them haven't been vaccinated because in their home country, vaccines weren't or aren't available. And so we see that, you know, as a need of action to vaccinate some of the individuals. In our state of Kansas, we do have a program that protects the children. So we do have what it's called Vaccine for Children program that immunizes or vaccinates kids regardless of whether they're uninsured or their immigration status, or if they have insurance, but they have a high deductible and or they don't cover vaccines. This program kind of protects them a little bit and makes vaccines available to them. And so just a little bit of facts in regards to the VFC program, it has prevented 472 million illnesses and helps avoid over 1 million deaths. So it saves also 2.2 trillion in total cost, healthcare costs.
So this is a program. How can people, if they've got kids, and regardless of insurance status or immigration status, or, you know, all of those things, those hoops that a lot of systems throw up, where can people learn about this? Like, is it on your website? Is there a link on your website at all? So I can definitely drop. Go ahead.
There is, Stacy, there is a link in our website. This can also be accessed through their local health departments. So the county health departments are some of the clinics that do participate very actively in the VFC program, and also federal qualified health centers. And so we know that many of our counties here in our state of Kansas doesn't have direct contact with federal qualified health centers, but they usually do have a local health department or a county health department that can assist them with vaccinations.
Okay, so check your county health department. Okay, so now you talked about outbreaks of diseases that had been eradicated. And when my children were young, I homeschooled my children. In fact, I homeschooled my children up until 2020. So I moved in some pretty conservative circles. And I know that there are a lot of people who, for various reasons, choose not to vaccinate their children. And I know some people who very strongly believe that vaccines have done harm to people. So what would you say to that? Like, and part of this is me, like, what do I tell my friends? How do you respond to that? And I know there are some people that it might be quick or easy or convenient to go, oh, well, they're just crazy. But some people have really deep concerns. So how would you respond to people who have those deep concerns about vaccine safety?
Yes, Stacy. Well, I think vaccines have been the greatest intervention of the 20th century. Mm-hmm. We've seen a lot of deaths throughout the years. Just a quick data here. Before the 20th century, 29,000 people died of smallpox, which mm-hmm. is chickenpox. In 2022, there was 0 cases reported for smallpox. Quick story. This is very personal to me. When I was younger, I was raised and born in Mexico, and our family did not have access to medical treatment. And unfortunately, our family was hit with the smallpox. Wow. 3 of us had smallpox. And I remember I was very young. I was probably 12. And my 2 younger siblings also had smallpox. My middle sister, she got so sick to the point that she had blisters in both of her eyes and inside her mouth. I did not have that extent of, complications. My youngest sister did not either, but my middle sister did.
Wow.
And seeing her, laying in bed without being able to eat, without being able to open her eyes, we did not know if she was going to lose her sight or not, truly made me think of, we did not have access to these vaccines.
Wow. Mm-hmm.
We didn't. And, we were so lucky that when we moved to this country, we were able to be vaccinated. And to me, vaccines are key. And, the funny thing with the COVID, and something that I did kind of saw, is that when the vaccine was developed here in the United States, there were people from other countries flying to Florida and to California to get vaccinated. Now, people that were doing that were kind of, some of the privileged or the wealthiest people of those countries, but still they would make the expense of flying to the United States to get vaccinated. I truly think that sometimes we here in the United States take for granted, mm-hmm. The development, the scientific development that we have. Every vaccine goes through very detailed scientific research. It gets tested, it gets approved, it goes through a review committee. So vaccines are safe and effective, and they protect the people that we love. They do.
So that's, I think even for myself, I'll just, full disclosure, when I think about smallpox, I think about something that happens far, far away. But to hear you, it's like you and your family, you had smallpox as a child. That's deep. That's crazy.
Yes, we did. And I do a lot of work around refugees and immigrants and asylees. And I would invite everyone to go into our website and look at the Honest Conversations campaign that we have going on. We do have an Afghan kid. He was 10 years old when he moved to the United States with his family, and he had never had gotten any vaccines. I happened to be there in the school when I saw the family come in. One of the community health workers that is trilingual kind of assisted the family in speaking, Pashto and their language, and hold the kid's hand and took him back to get his first lifespan doses of vaccines. And it was just so humbling to see the reaction of the mom. She, started crying, and she was like, "Thank you." And it's so different. That reaction is so different to what we see in other groups, especially those anti-vaccine groups. It was definitely very heartwarming.
So I wanted to touch on, obviously, again, the elephant in the room right now is COVID, but there are other vaccines, and my children now are 12 and 14, and they're up on all the shots. But there are, speaking of your the Conversations video series, so there are vaccines that we continue to get through our life cycle. HPV is one. I know there are vaccines, or talk about that, like HPV, or the fact of booster shots. Like I know I just recently got a tetanus booster, and I'm 50 years old, and I'm like, oh, I'm still getting immunizations. But now I'm 50 years old, so now some of my friends have gotten shingles, and they're like, good Lord, that is the worst thing that could ever happen in your life, is to get shingles. Please go get, so we think a lot about childhood immunizations, and COVID is its own thing. It's its own thing. But what about the other immunizations that sort of go on through life?
Yes, Stacy. Yes, it's so important to make sure that as you get immunized, you ensure that you do take that first dose. And some vaccines do require a second and then a third, like the HPV, depending on the age that the kid starts, that might require 2 or that might require 3. And then also for the adults, it is important to get your Tdap, which is your tetanus, diphtheria, pertussis, boost every 10 years, especially if individuals work in any construction or meat processing plant, or any where you would use any chemicals or anything that you might become in contact with blood pathogens. It is important to be vaccinated with the Tdap every 10 years. HPV has been one of the vaccines that we have been focusing on. It is recommended for kids 9 to about 19 years old, but just recently the CDC released a statement that it can actually go up to the age of 26. Now, that's when it proves more effective. It doesn't mean that if you are an adult and you wish to be vaccinated with the HPV vaccine, you can if you want to. The effectiveness might not be the same, but it does prevent about 97% of all cervical cancers. And so it is a vaccine that we are seeing some data being released now. And it is very, very, it's very good to be able to see the data that kind of allows us to talk to the public about the effectiveness of this vaccine.
Mm-hmm. And then shingles too.
Yes. So the shingles vaccine, it is again an important one. I think that one, a lot of the individuals that I get comments back on this, they usually are kind of hesitant about getting shingles because of the cost. So if individuals have insurance, yes, please go get your shingles vaccine. If you don't have insurance, it's always good to check with the local health department. Shingles is one of the most expensive vaccine that we have. I think it's probably the most expensive. And so a lot of the insurances don't cover it.
Wow.
And so it is kind of alarming when we think about, making it available and accessible to everyone.
That's a bummer, because I've heard shingles is no fun.
Yes, it is not. No.
Wow. Okay. And then what are you noticing any other trends? I mean, I know I wanted to bring up also, there's also in terms of adult vaccinations, the HPV, the shingles, and then like Mpox. I know they're moving away from calling it monkeypox, but there is a vaccination now for Mpox as well.
Yes, I think maybe some of the trends that we've been seeing that are kind of alarming, and we'll talk a little bit about Mpox once I talk a little bit about this. I think that because of COVID and because of, this misinformation and questioning and all of that, we have seen an increase in exemptions. And so if an individual has a medical condition that doesn't allow the individual to be vaccinated, and that's what the provider recommends, that child or that adult, doesn't get vaccinated because of that medical exemption. Now, because the population has been vaccinated, there's kind of that herd immunity. So everybody else kind of protects these individuals that are immunocompromised or that have a medical condition that doesn't allow them to get the vaccine. Well, because of what we have been seeing in regards to society or the public mistrust, we have been seeing an increase of religious exemptions, which is also one of the exemptions that are allowed here in our state of Kansas. And so we have been seeing an increase of that, which means that less individuals are getting vaccinated. We are seeing a lot of individuals still being kind of behind their immunization schedule. And so during COVID, many of the clinics and many of the parents did not take their kids to get vaccinated because, they were kind of afraid of the pandemic and, getting infected. So many kids are behind schedule. We have this fear of the adults, not wanting to vaccinate their kids. We are seeing an increase of religious exemptions. And now through our legislators, they were trying to pass a philosophical kind of exemption. So we're seeing this wave of, increase of exemptions and increase of unvaccinated individuals.
And the only logical outcome of that is that people are going to get sick. Like the only way if fewer people are vaccinated, the only end of that road is that more people are going to get sick.
Well, and Stacey, think about it. More people are going to get sick. They are going to go to the hospital. The hospital's already tired. We are talking about a healthcare system that is tired. During the pandemic, 98 of the 100 administrators for the health departments, they quit. They either resigned or left.
I remember I was on a call when I first got this job, and I can't remember now what the topic, but I remember I even posted about it on Facebook, so it comes up in my memories about how many healthcare providers, how many county health department, how many just, people were like, I'm out. Yeah.
So we have a healthcare system that is tired. They're tired. I mean, we are talking about nurses shortage all across our state. We have a healthcare system right now that needs us to be healthy, and having all these exemptions, not keeping up with our preventative visits, are only going to harm our healthcare system, because that's where people go when they get sick. Yeah. And then, the nurses and hospitals get overburdened with all of those illnesses.
Yeah. So I briefly wanted to, there is a question in the chat, but this question says, is it true that long time, like COVID long timers will suffer with symptoms like fibromyalgia? I don't know if that's referencing to after the vaccine, because this conversation is more about vaccines as opposed to long COVID. That's a whole different topic. But
it is a whole different topic, Stacy. And just remember, everybody reacts a little bit different. And so there's really no long-term effects that we, that we are thinking of experiencing with this shot, with this vaccine. But that's not to say that that couldn't happen to an individual.
Right. And then lastly, we're at 30 minutes already, but I did want to bring up, you have a Kansas immunization conference in June that is open to the public. I know it's on the website, so people can go check it out. So what are some of the things that are going to happen surrounding your immunization conference?
There's going to be a lot of good speakers there. KDHE has been doing a great job putting this conference together. We will be able to not only hear from the CDC itself, but also from some of our doctors and individuals talking a little bit about immunizations and the effects of it.
Well, fantastic. All right. And all that information can be found on their website. If you go to the Immunize Kansas Coalition website, one of the first things that comes up is the calendar. And that's how I was like, oh, look, there's this thing. So it's super easy to find on their website. And yes, and I was sad to see that I missed adolescent immunization week, but since I have adolescents, but we know that they are, we're getting them. They have doctor's appointments, and even the school notified them that those adolescent immunizations, they still have to get them. So thank you so much, Geovannie, for joining today.
Thank you, Stacy. Just wanted to finish up with the phrase that I love. And just remember, diseases will only stay eradicated as long as vaccination is still being used. And so, we've come so far with eradicating diseases. Let's not go back. It will only stay that way if we continue pushing immunizations.
I agree. Thank you very much. All right. Thank you so much, Geovannie, for joining us today. And I will be back next Monday with another Lunch and Learn. Everyone have a fantastic day. Go be awesome.